Yeah, come in.
Well, my name is Ethan Bolarowski. I'll be your student nurse for today. The doctor has ordered some vital signs to be done, as well as checking your cardiovascular system and your respiratory system. But please let me provide privacy, wash my hands. Can you also give me your full name and date of birth?
Abraham Lincoln,
Okay, and your date of birth?
July 4th, 1776.
Okay, and let me check your wristband. Okay, seems to match that. And also I have all my equipment so we can begin. First I'll start with your blood pressure. Do that. Do you have a preferred arm?
This one's fine.
Okay.
Do you want me to put the sleeve up?
No, it should be thin enough.
Okay.
Okay. Just gonna squeeze a little bit. Okay. It is 125/75, so within normal ranges. Now I will check your pulse rate and your respiratory rate. So just breathe normally for me. I'll check your radial pulse. I'll do that for 30 seconds. Okay. Your pulse rate is 64 and your respirations are 12, which is also within normal ranges. So then we can move on to the respiratory portion of the assessment. First we'll start with inspecting. I'm inspecting your chest. There doesn't seem to be any irregular labor or anything different. It just seems to be normal, which is good. Then next I'll move on to listening to your lung sounds on the 4 lobes on your chest and your back. So just breathe normally for me. Then I'll also do that 2 times on your side. Okay. Just breathe normally. Okay. Okay. Same thing on your back. Okay. These are on direct contact with your skin, and I'm listening for 1 cycle. So I'm doing it twice, 2 lobes on both sides. Okay. Nothing abnormal. Everything seems to be fine. Next, I will teach you about the turn, cough, and deep breathe technique, which is basically you turn, you cough, and you breathe deeply, which expels mucus, keeps your lungs expanded. And a similar thing is incentive spirometry, which you do 10 times in an hour. It expels mucus as well. It helps breathing. Just helps you breathe more, especially after any surgeries or anything.
Okay.
And how you do it is you just inhale. You inhale into the spirometry, which is this. Then you inhale slowly into it, then you hold. And then if you have any cough or anything, you could just cough, get rid of the mucus, and then it helps. So we have to do that 10 times in an hour. So like every commercial break or anything should be fine.
Okay.
Do you have any cough or sputum or anything?
I don't now. No.
Okay, that's good. And no trouble breathing or anything as well?
No. Breathing is easy.
Great, we can move on to the cardiovascular portion. Do you have any heart pain, heart pain or anything like that, heartburn?
No, not really.
Okay. The first thing I'll do is also inspect your jugular venous pulse. So please just turn opposite of me and then I'll look. Okay, there doesn't seem to be any distension. And I'll check the other side as well. Okay, doesn't seem to be distended as well. So those are good. Next, I will.
Sometimes if the vein pops out, is that what you're looking
Yeah,
for?
that's what I was looking for. Sometimes it distends,
Okay.
and that can cause problems, but it seemed to be okay. Next, I'm going to, once again, feel for some pulses. I'll do radial again. Even though I did do it earlier. Okay, I'll do that for 30 seconds. Okay. This is normal. Has a strength of +2. Next, I'll do the posterior tibial on both sides. Okay, which is behind your, on the inside and behind your foot. Okay, they also have a strength of +2. Then I'll do the dorsalis pedis, which is on the top of your foot. Check that on both sides. Okay, it also has a strength of +2, which is good. Then I will also tell you the anatomical positions of your carotid, which is in your neck. The popliteal, which is on the opposite side of your knee.
Here?
On
the back side.
Yeah, on the back side.
Okay.
The brachial, which is on the opposite side of your elbow.
Okay.
Here and here.
Right in here. Okay.
Femoral, which is in your groin area, and axillary, which is under your armpits. Okay, that's good. Next, I'll check your capillary refill. So I'll squeeze your fingers on both sides. Okay, I'll just do these. Okay. Color came back within 2 seconds, which is good. And I'll do it on your toes as well on both sides. Okay. They came back in 2 seconds, which is good. No problems there. Next, I will first inspect and then palpate for edema. I'll do that on your hands. Similar thing, but I will squeeze from proximal to distal, or distal to proximal, I'm sorry. Squeeze, okay. Doesn't seem to be any edema on both sides. I'll do it with your feet now. Okay. Seems to be good. No edema or anything. And
That's the swelling, right?
yeah, no swelling or anything, which is good. Next, I will listen to your heart sounds. Doing your aortic, pulmonic, herbs, tricuspid, and your mitral. So once again, I'll do it directly on your skin. Okay. It's going to be on the right side in the second intercostal with your aortic, pulmonic, second intercostal on the left side, herbs, third intercostal, pulmonic, fourth intercostal, and then mitral on the fifth intercostal. I'm also going to listen to your apical for a minute, listen to any abnormal sounds. Okay, that was a minute. There doesn't seem to be any abnormal sounds or anything. And I was using the diaphragm, listening for those higher sounds. If I use the bell of the stethoscope, I'll be listening for lower sounds or anything abnormal, such as S3 and S4, but there was no abnormal signs or anything, which is good. Kind of seemed to be everything for the cardiovascular. And finally, do you have any sort of pain or anything? If you did, what would it be from 0 to 10, 10 being the worst pain you've ever experienced?
Still have a kind of a knee.
Okay. Can you say what's that from 0 to 10?
It's a 1 or a 2.
Okay. And what makes it worse and what makes it better?
Icing it seems to make it better, and resting it.
Okay.
And what makes it worse is when I run.
Okay. And what type of pain does that feel like?
It's more of a throbbing.
Throbbing pain. Okay. What would the location he has on your knee? Does it spread or anything, or is it?
No, it's right there at the joint.
Okay. And the intensity you said was a 1 or a 2. When did this start? And how long has it been for?
About a month or 2 ago.
A month or 2. And it usually flares up when you're running, or.
Yeah, no, it actually that kind of aggravates it, but
Okay.
it clears up after I'm done and after I rest it.
Okay. Well, that seems to be everything. So.